you just explain a little bit more what the logistics are of providing medical care to the people who are in South Sudan right now?
Yeah, it's quite complicated in the sense that, as I said earlier, South Sudan is a very vast country with little infrastructure. So to provide medical health care in perhaps peripheral area is challenged by the lack of roads, by the a poor transport system. In some cases, locations are difficult to access because of insecurity, because of, well, now soon we will have in April the rainy season beginning, so roads will turn into mud and it will be even more difficult. So in practice it means that we are flying from Juba or from other locations to supply our hospitals, our clinics, our staff with the drugs they need, with the materials they need. I mean, at the moment, I think we are running more than 16 clinics or hospitals in the country. Yeah. And some of them are big hospitals, some of them are smaller clinics. And they will need drugs, they will need medical supplies and the likes. So we know from experience, having worked in South Sudan for 30 years, that the logistics is the main challenge because of the poor infrastructure, basically.
And how many people would you say Doctors Without Borders treat daily?
That's a bit difficult to say. In the past, since the crisis has escalated in mid-December, we've treated more than 25,000 people. So we basically carried out more than 25 or 26,000 consultations. And of course, the number of people we reach on a daily basis keeps growing. But it is in many different locations, so in camps in the capital in Juba, in camps other places, and in our hospitals and clinics in some locations which are functioning independently or functioning unaffected to some extent by the current conflict.
And maybe you can explain for us, what are some of the more common types of treatment people are coming to you for during this time?
So the main diseases that we're treating at the moment is malaria, especially when people are displaced from homes and they live in the open. You'll see an increase of malaria because people are sleeping in the open. When people don't have access to clean drinking water or proper sanitation, we'll start seeing more diarrhea diseases. And the part, of course, with the current environment goes treating of wounded as well from the current conflict. Both, well, any civilian or any person that's injured as well, we'll treat them, of course. And then, so the main morbidities or the main diseases we are treating is malaria, diarrhea diseases, and what we call respiratory tract infections, so pneumonias, because people are sleeping in the open. They don't have the same shelter and the same protection from the environments that they would have prior to being displaced.
And despite the conflict that's happening in the South Sudan and this myriad of diseases and injuries that you've just explained, do the people there remain positive?
Well, I think a lot of people that we see in our clinics are concerned, which is very understandable. They've gone through so many traumatizing experiences, both from the past, but also now the recent conflict. So people, as I said earlier, have fled with minutes of notice. So that in itself is a trauma and very stressful for people. And in some cases, in these camps in Juba, for example, people are fearing for their life if they leave the camps because they know that they have been targeted, other people from the same group, and these environment makes people concerned, and a lot of the patients we see are very fearful. It's I think more basic than being positive about the whole process of peace, for example. People fear to a large extent for their lives, for the lives of their children, first and foremost.